Okay, so these are the tumors of external ear. Okay, the first one is called, the name are a bit complicated. Even I was not able to remember it. The name is basically, these are the Latin, as I guess these are the Latin names. So one is called as the Chondrodermatitis, Nodularis, Chronica, Helicis, or also called as the Winkler's disease. Okay, Winkler's disease. So forget the first name, remember the another name called as the Winkler's disease. Apart from that, we have these form of tumor. One is called as the Squamous cell carcinoma. Another one is called as the cystic chondromalacia. Another one is called as the axiostosis, or also called as osteoma. Then we have ceruminous gland adenoma, and we have the ceruminous gland adenocarcinoma. And my friend, these all are the benign type, and this one is the malignant type. These all are the benign type, means they disturb their origin only. But if they disturb not their origin only, they can also disturb the adjacent tissues or adjacent organ. Fine, no problem. Now let's go. Why? Yeah, that is what we define the characteristics of cancer. That is called as the metastasis. Means there are certain form of cancer. There are basically certain form of cell division. Okay, that are so fast that once they will grow, they can detach from their main origin, the primary site, and then goes to the secondary sites. That is called as the metastasis property. Fine. So before going to the first disease, I will make you understand through one cancer elimination how cancer cells look like.
Great. Nothing else is there.
Okay. So first we will go with the benign type of tumor. So this is your tumor. You are saying this is our tumor, not our tumor. This is a patient tumor, and this type of tumor is this is a benign form. Okay, these are the benign form of tumor. Fine. If you zoom it, you see, ma'am said one thing, that there is something called as the structural functional relationship. Means we have the regular structure basically. Okay, and as you seeing, once cancer develop, it can also change the shape. It can also change the shape. So there is a irregular shape. Fine. And if it is visible to you or not, see the blood vessels. These are the blood vessels. Are you able to see it? Able to see it? Fine. So these blood cells are arising, and this is called as the angiogenesis. A new blood vessels are forming. Just because the cancer cells are able to form a fast rate of the blood vessels, okay, that's why they spread. That's why they grow faster. Okay. Remember, cancer cell need less nutrient to grow. Cancer cell need less nutrient to grow as compared to our normal cell. Cancer cell need less nutrient. Fine. And they have the property to form the blood vessel. That is called as the angiogenesis. So these are the vasculature, as you are seeing. These all are the vasculature, and these are the basically a tumor, which is a benign type. Now we will go with the malignant type. Okay, so this is your malignant type of cancer. Okay, malignant type of cancer. See, just observe how they are growing. Okay, once observe it, I will play. See.
Certainly. Michelle.
These are the small tumors. Okay. As I said you that cancer need less nutrient, okay, and they have the fast cell division. They have the fast cell division just because the blood supply, they have the, you can say the tremendous blood supply, means sufficient blood supply to grow fast, okay, and you can say make their progeny basically. as we know that we call it as something daughter cells. So there are also something called as the daughter oncogenes. Okay, daughter oncogenes. So cancer cell also divide. Okay, they have also property of mitosis. Okay, and faster as compared to our normal cell division. Cancer cell grow at a faster rate. See the growth. Okay, how they are growing. Fine. Okay, now let's go with the slide. So we discussed the classifications, we've seen the key points about the ear tumors, we also seen the tumors of the external ear type. Now the first type. First type is called as the Winkler's disease, or also called as the Chondrodermatitis nodularis Helicis or Winkler's disease. Okay, this is a benign type. This is a benign type. You see the image. Are you in cancer is visual to you? The tumor basically are visual to you. And this is a painful conditions. Even though they are not a malignant type, but pain property is intact. Okay? Pain property is intact. Now, you are not asking the question, but I keep asking questions from myself. Whenever I prepare the slides or whenever I want to prepare something, I ask questions across, you can say study. I study and I ask that why cancer appear mostly on this helix region? Why not the other region? Then I got to know that the blood supply of this area is very delicate. A blood supply of this area is very delicate. So whenever is it any small problem, then there is a higher chance to develop a cancer on this area. Okay, no problem. Now, another thing we already seen that due to the obstructive change frequently found in the artery, this condition appear. Fine. Now, the another interesting thing about this type of cancer, the Winkler tumor, the external ear tumor, is that it can arise of just because of our certain new behaviors, like we basically put it the headset, the headphone, the tight earphones, iPod and whatnot. Okay, so these things basically put it the abnormal pressure on our ear, and one study recently shows that can lead to the, you can say, a production of this cancer, this tumor, basically Winkler's tumor. Okay, no problem. So avoid whenever it's possible, avoid, and mostly if you sleep with the wearing of those headphones or those earpods, it's basically a risk factor. It can cause a cancer, or ear cancer, ear tumor. Fine, no problem. Now, and these diseases are more in the male. Why? Why this is more in the male only? Not okay. See, this is more present in the male. I'm not answering actually your answer. This is mainly present in the male, but the females are also affected. The children are also affected. Fine, no problem. Now, and there is one clinical problem, and that is not for our concern, but we have to understand it. There is another type of cancer called as the squamous cell cancer, which is also external ear tumor, basically, which we are going to discuss after 1 minute. So basically, that cancer, basically cancer of the squamous cell carcinoma, and between this Winkler's disease, there is one commonality. Okay, there is one commonality, and that commonality is that both the cancer are sometimes, you can say, confused to difference. Okay, make the difference that this is this type, this is this type, just because both the cancer appear in the ear, first of all, external ear, and there is a very minimum, you can say, clue to understand that this is a squamous cell carcinoma and this is a Winkler's tumors. Fine. So that goes with, in the case of Winkler's carcinoma, you've seen this type of, you can say, the cancerous growth, and that is called as the pseudoepithelioma. Okay, pseudoepithelioma is a term which denotes that there is a false, you can say, epitheliums are present over the external ear. Fine, but in the case of squamous cell carcinoma, this is absent. So this is one of the marker. Okay. So coming to the management of the first disease, that's called the Winkler's tumor. Management goes with both, primarily with the surgery, okay, and another one is a cosmetic adjustment. So surgery is done, and this is called as the pinectomy, cutting, okay, pinectomy. And another image, as you are seeing, this is basically a cosmetic, you can say, intervention. This is a cosmetic intervention, and this is the form of surgery. So these are the two treatment ways. Now, coming to the squamous cell carcinoma, probably this is the last type of cancer which we are going to discuss today, and we have, if time, we will discuss in future about the other cancers. So fine, now, squamous cell carcinoma. Squamous cells is a form of epithelial cells. We already know, fine. And we know that epithelial cells, basically our whole body is made up of the 4 kind of the cell, and one of the type is the epithelium cells, okay. So in the ear, epithelial cells are also lining the ear, fine. So if the cancer appear on these cells, this is considered as a squamous cell carcinoma, fine. And this is the 2 type. It can occur in the only over the pinna, or it can occur on the auditory meatus or auditory canal, fine. So the first image, as you are seeing, this cancer is appearing on the pinna, over the pinna, fine. This is a cut section of your ear for the measurement, and this is called as the pinectomy, okay, and this is the basically a 3D diagram or 3D image of the pinna, okay, 3D image of the pinna. So this is a cut section, this is the original image, and this is the you can say the 3D image, or it is called as the fluorescent CT scan or MRI, okay, with the dyes, with the color. Now, coming to the external ear canal, the external ear canal cancer can also appear, as you are seeing, and this is a, you can say, the stages. It's not visible here, okay, I think it's not properly visible, but if you are seeing these 2 portions, is arrows are visible to you, these arrows, this is the tumor, and this is your ear canal, and this is the rest of the ear part, fine. So, and these are the tumors, fine, and if you cut the tumors, then this ear, if ear is cutted, a pinectomy is done, then this is the internal structure, how deadly it look like. See, these all are the cancerous growth, fine, no problem. And this is your CT scan, okay, this is your MRI, okay, magnetic resonance imaging, fine, no problem. So this is about the squamous cell carcinoma, okay. So I prepared this much slide only. I hope you understand. If you have any question, you can ask me. You have any question?
Yes, sir. But you couldn't have any last year.
No, you have question? No?
Yeah, some. Yeah. Listen. What are they doing?
You can ask think about. Yeah, sure. You can ask hearing. Well, okay, I'm done. Yeah, that's good question. There are certain devices, auditory devices. You cannot hear through, natural hearing phenomena as you are hearing previously before the cancer. But yeah, you can still, you can say, hear the sound when then, but you have to also always you have to carry some ear device, called as the oscillometers and certain other device. There are certain advanced devices.
What about the other area which is not?
Yeah, that's a good question. What happens is our normal tendency. If you put one finger in this nose, then higher chances we also same finger will put into the another nose. So sometimes what happens, we take one ear, what is called that? Earbud. Yeah, earbud. We clean and we are using same. You can spread this. There is chances. And leave it. It is mainly case in the infectious cancer. Okay, those cancer arises just because of the certain infectious agent. We are going to discuss next ahead. That can cancer is straight. Apart from that, internally, if the cancer is malignant type, the cervical cancer, basically the cervical adenoma, that can spread to the both here. Yeah, there is a higher chance it can spread. Yeah, there is no stages of cancer. Yeah, no stages of cancer, as I understand. The one reason they basically write on the articles is that there is a problem to determine the location, first of all, location that cancer appears, because this inner ear and middle ear cancers, they are, you can say, look like same, first of all. Apart from that, the origin is not, you can say, certain. Means, if cancer appear in the inner ear, fine, and that cancer is spread to the middle ear, okay, inner ear to the middle ear, and both the cancers look like same. So we have less clinical data to understand the origin, where origin happened first, fine. So that's why the one way to define it, staging is absent. Her lymph node or blood supply is present. Stage that can measure, how can you measure the blood supply or not?
Somebody has to buy PNS development.
No. Stages of cancer, yeah. Lymph node you can determine, okay? But the tumor size, they are the same. The malignancy property are, you can say, not known. That malignancy property is hidden. Like, we are not able to identify the location, the malignancy, where it arises first. So to us, yeah, based on the blood, that's the one way to make the difference. But generally, as the articles write, that the staging system is absent in the case of ear tumor and the temporal region tumor.
Honestly, all time they can best to 10 best.
We have endoscopies. We have endoscopy apnea. Exactly. These are the internal parts. We don't have the, you can say, much those invasive imaging techniques. That's the one way to answer. Maybe. Another, you have question? You have any question about cancer? Ear tumor? No? Okay, so thank you for having us. Bye. Have a nice day.